The first at-home test for cervical cancer screening was recently approved by the FDA. So what do we know about the pros and cons of at-home testing?
Well, Dr. Wendy McDonald is joining us now to break it all down. And Dr. Wendy, when I first heard about this, I'm like, I don't know. Who's actually going to be testing this? How do I know if I got all the cervical cells that I needed to get? Tell us about this test.
So it was approved as an at-home swab. So the idea is that HPV, human papillomavirus, is detected with DNA PCR. So, which is like, you know, basically a pretty specialized test that if you collect cells that are close enough to the cervix, you should be able to detect if that virus is there. The good news is a person wouldn't have to do it every year, just like we don't need PAPs every year anymore. But the idea behind it is that there are some people who either just don't go to the doctor or they have barriers, right? Whether it's insurance, whether it's appointments, maybe there's anxiety. And so does that person then not have the opportunity to have any screening? No, like they should be able to have some sort of screening. So I like the fact that there's more access.
Okay.
Yeah. And HPV is a virus that many people carry. Some people don't even show signs that they carry it, right? Isn't a large percentage of the population?
It's like 80% of people are exposed to it in their lifetime, but not everyone will contract it.
Okay.
How accurate is it? It's pretty accurate. I mean, there's some testing that says if it's done properly, some results that say if it's done properly, it's on par with the PAP that's done in the office. So the accuracy should be there. My only concern is, I wonder if the person who doesn't want to come to the doctor, who is maybe nervous, are they going to get the swab in enough, do enough to be able to collect what they need? So it's really about making sure that it's done properly, but I still think the access is good.
There we go. Access is good, but your user error is a possibility.
It's a possibility. Okay. And it doesn't replace seeing the doctor because, I mean, you're more than your cervix, right? We should be able to do our whole exam, make sure that everything is good, talk about problems. So it's not that it's a replacement for seeing the gynecologist, but it can at least help to screen and catch some issues.
Got it. What about STI at-home test kits?
So there's a newer test as well that will test for some of the most common results that can be in the vagina, basically. So we're talking about gonorrhea, chlamydia, trichomonas.
Okay.
Ooh, that can
scary.
be right.
Wait, when did they become STIs? I thought they were STDs.
Well, okay, it's semantics, right? Sexually transmitted disease versus sexually transmitted infection. Infection sounds better. I don't know.
I think so. Yeah.
It's the same thing. Yeah. It's the same thing. But yeah, it's a swab, again, that goes inside to make sure that you're collecting these, you know, cells and kind of getting the results. But are we putting it in the right place? Are we making sure we're getting enough tissue? But at the same time, we are making sure that, you know, people are being checked and catching issues.
I mean, these tests can't be cheap, right? How much do they cost?
That's one barrier. Now, I don't know the exact cost, but that is a barrier because a lot of insurances, at least at this stage, won't cover the at-homes, right? So you're kind of doing that on your own. And I have seen anywhere in the order of $50 to $100 per test.
So what are you collecting them and mailing them somewhere?
And then once the result is received by the lab, they're saying that you can actually get the result back within 30 minutes of the result. Now, here's the thing. Once you get a positive result, say positive meaning abnormal, right? You have an infection, you still need to contact a provider. You're still going to need to get, you know, treatment, but at least you know that you're having some level of screening. So I think there's pros and cons.
What about us premenopausal women that want to know what our hormones are doing?
So if a person has, say, chronic fatigue, they're having like significant sleep disturbances, they're having irregular cycles, they're having abnormal weight gain, there are actually now at-home hormone tests. So we can check your thyroid, estradiol test, which is your estrogen levels, FSH, LH, which are other hormones that kind of secrete from our pituitary gland down and communicate with our ovaries. These are tests that also can, you know, be submitted and done online. Now, the only challenge, or not online, I'm sorry, at home, but the only challenge with that is like a saliva test, you know, swab that you send in, but where are you doing it in your cycle? Because sometimes those values can be normal or abnormal depending on where you are. Was your period recent? Is your period coming? So I think that this is still, again, good catch-alls for, you know, any kind of disruption, but sometimes those results can look abnormal, but if you check them at a different time in the cycle, they actually are normal, or vice versa.
And we've been hearing so much about the rise of colon cancer in younger people. How do you feel about the at-home colon cancer test?
Yeah, so there's the stool-based testing where you actually send in your poop, you know what I mean? And then there's also testing to make sure that there's no like blood in the stool. Those are great. I mean, some test is better than no test. I think a colonoscopy is still the gold standard. I think it is still the gold standard. But again, you have to have a ride, you have to have insurance, you have to make sure you have time.
Real quickly, these sperm count tests, are they good or bad?
They're good. I mean, I think if you have demonstrated some level of infertility, let's check both people. I mean, this takes two to tango. Takes two to tango, okay? But yes, I definitely think that those are helpful too. But again, if there's an abnormality, then you got to see a urologist. And if it's normal, then, you know, there still doesn't mean that there's no issue, so.
Oh, wow. Dr. Wendy, thank you. There's a lot of stuff out there to kind of unravel for everyone. For more information, visit loopobgyn.com or give them a call, and you can follow Dr. Wendy on social media at Dr. Everywoman.